So I welcome all the attendees and today's resource person, Dr. Samar Singh sir. I have also spent 1 year with him during my stay at JNU during my postdoc. So Dr. Samar Singh sir, as you all know from the flyer, he is working at
Hello.
Institute of Medical Science, Banaras Hindu University, and he has spent several years at Punjab University also. And before joining Punjab University, he was also Ramalinga Swami Fellow. As you all know, this is very prestigious fellowship. So he also gets second term, as I remember in Ramalinga Swami Fellowship. He has spent several years as postdoc fellow in USA, and then he joined as a Ramalinga Swami Fellow at JNU. And he also did his PhD from Jawaharlal Nehru University School of Biotechnology. And he has published more than 50 research paper in different reputed journal and on different topics. As you know, he did his PhD in normal science. Normal science means biotech, but he's working in the Medical Science Institute. So that is also unique, I think. So he has more than 20 years of post-PhD experience of research and teaching. Kanwar has also joined to listen him, Dr. Kanwar. And I'm lucky that today one of the attendees, Vice Chancellor of BN Mandal University, Professor Bimlendu Sekhar Jha, has also joined here in this. So with this brief note, I invite now Dr. Samar Singh sir to deliver his lecture. Sir, welcome, and we are grateful to you for accepting our invitation. Samar sir, unmute.
Thank you.
Yes, sir.
Thank you, Dr. Gopal ji. I like to welcome everyone. A very good evening. And many of us may have already known about zinc supplementation and may have used it in the past, including the recent COVID-19 pandemic, with different objectives that may have ranged from strengthening our immunity to faster recovery. And it may have been with prescription or without prescription, as there is a lot of confusion with regard to why or whom should and when we should go for zinc supplementation. In today's talk, we will discuss about myths surrounding zinc supplementation and sufficiency in acute infectious diseases like COVID-19 and our struggle to get the record straight, and it will give some clarity on the subject. So let me start with the presentation. Share screen.
Share a screen.
Yes. Share screen. Is it visible now?
नहीं 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 इंटायर स्क्रीन करिएगा इंटायर स्क्रीन एंड नहीं आ रहा अभी
नमस्ते समर
Entire
सर
screen करना है ना?
शेयर
नमस्कार, नमस्कार। विंडो करना है ना?
नहीं नहीं
Entire
इंटायर स्क्रीन सर करिए अब फिर जो आएगा विंडो दिखेगा उस पर थोड़ा कर्सर ले जाएगा क्लिक करिए आपने तो किया हुआ है
आया वही शेयर कर रहा हूँ शेयर और
एक विंडो दिख रहा है उस पर क्लिक करिए फिर शेयर करेंगे तो आएगा यस यस
आ गया
यस सर
Okay. So
Yes.
let's move forward. So my sole intention is to increase and strengthen awareness through this talk about the zinc supplementation sufficiency in acute infectious diseases like COVID-19 and why it is important, because inappropriate zinc supplementation practices could be contributing to therapy failures, inflammatory damages, and associated health issues. Additionally, increased pathogen transmission and antimicrobial resistance emergence may be being contributed by it. And I would also like to read the disclaimer here that all information that is being discussed, shared, is for awareness and educational purpose only, and it is not meant to replace or change a medical advice. And images and information used are copyrights of their respective owners. They are being used here just for the educational purpose. So let's move on. Before we start, I would like you to quickly answer these for an interactive discussion. It's just for yourself. Like, have you taken or considered zinc supplements in COVID-19? Do you take zinc supplements during infections like respiratory diseases, cold, flu, etc.? Do you take zinc supplements for any specific reason or actively considering it? If the answer is yes, please stay till the end to learn something new that may equip you to better decide for yourself. So let's move forward. So, as most of us may be knowing that zinc plays a diverse role in immunity, and its role is multifaceted and no denying about it. And it plays key role in innate, acquired, humoral, and cell-mediated immunity, as it is required for replication, transcription, translation, and superoxide dismutase activity, netosis, etc. But the question is, how much justifies this zinc supplementation during acute infections? So this gives you broad outline of today's talk. So I will be talking about the background, how COVID-19 impacted globally, and the unprecedented off-label drug usage promotion during the period, zinc supplementation advocacy premises and implementation, and evidence for zinc deficiency as a risk factor from first wave of infections of COVID-19. Then we will have an overview of truths and half-truths about zinc's role in immunity and supplementation, zinc sufficiency and COVID-19 impact correlation. Here we will be looking at the European population as well as global, and myths surrounding zinc supplementation promotion. And then finally, zinc supplementation in nutshell with further readings. So let's start with COVID-19 emergence and its global impact. So this slide is just to remind you or all of us how COVID-19 impacted us. It was a novel disease that appeared in 2019 from China. But if we look at how it impacted different countries, as you see on the top right-hand side here, deaths per million by 26 June 2020, it appears that it impacted the different countries differently. And there was no treatment available, and it is estimated that overall like 7 million people died from COVID-19 alone, and it also caused 19 to 36 million excess deaths. So as you look at these panels on your right hand side, the top one is about deaths per million population and lower one is cases per million population. It is quite clear that it has impacted more the developed countries while less the underdeveloped or developing countries. So let's move forward. So as the COVID-19 was a new disease, so it caused widespread panic and uh, allowed us to take unprecedented measures. As no treatment was available, many off-label use of drugs were suggested and recommended, whether they were rational or irrational, as we will see later. So some off-label drugs that were recommended during this COVID-19, as you may remember, there were supplements like zinc, selenium, vitamin C, vitamin D, antiviral agents like remdesivir, lenopinavir, antihelmintics, antimalarials, macrolide, antibiotics, steroid, etc. But all these widespread prescriptions and off-label use were contrary to the WHO guidelines which asked for rational use of the medicine. Despite this, the rational use of drugs was cause for major concern, as some of them are even associated with serious heart disorders and deaths that we observed in COVID-19. So, zinc supplements were endorsed early in the pandemic, causing frenzied off-label usage as immunity boosters, and remained a major drug used during the majority of pandemic, as there was no sure shot drug available for the COVID-19 during the whole period. So why junk supplementation was advocated. So as I also mentioned earlier, and we all of us maybe remembering that zinc has a role in immune competence and it displays antiviral and antioxidant activity. And zinc deficiency is quite common in globally, as you see in this panel, this map over here. So the things that are in light colored, they show higher zinc sufficiency or lower zinc deficiency, which are usually the countries of the Americas and Europe, while the countries in Africa, sorry, just a minute, countries of Africa and here over Asia are having higher zinc deficiency. So it was thought that as zinc has a role in immune competence and displays antiviral antioxidant activity, people were taking zinc supplements with or without prescriptions. So let's move on. So this slide again gives you a glimpse about why or what were the considerations that led to zinc supplementation advocacy. So as you see on top here that in COVID-19, the groups which were showing higher mortality were also that are known to have lower zinc sufficiency or those who display higher zinc deficiency, and they are also elderly and they have different comorbidities. And it is known that zinc also plays role in viral replication. It is needed for antiviral response, maintaining the integrity of the epithelial system that wards off the infection, and also activity of different immune cells. That was the reason that it was being advocated for preventing the COVID-19 adverse events. And if we look at this figure, you can see that whatever being said that zinc is going to play antiviral role or increase the immune system's activity. If we look at the zinc concentration that we usually observe inside a cell, like over here, can you see my pointer? Hello, Gopal ji?
Yes, sir, we can see that.
हाँ हाँ छोटा दिख रहा है, लेजर पॉइंटर टाइप नहीं, छोटा दिख रहा है.
अच्छा, सॉरी.
राइट क्लिक करके लेजर प्रिंट कर लीजिए सर.
अच्छा, एक मिनट. As you see inside the cell, the zinc concentration is maintained in the range of nano to what's a picomole, and outside it's also like in micro to nanomoles. But zinc that shows the antiviral activity is many times, at least 10 to 100 times higher concentration that is needed to display antiviral activity. But despite that, the zinc was promoted as a antiviral agent that can help the immune system to get rid of viral infection. So let's move on. So let me recap whatever we have or what we know about. The SARS-CoV-2 emerged in China and it caused COVID-19 and there was no treatment available. So zinc supplements and sufficiency was prescribed, promoted as an immunity strengthening with the premise of widespread zinc deficiency in masses, as up to 40% in India and African population zinc deficiency is noted, whereas in European population the zinc deficiency is quite low and less than 15%. And in first wave of infection that started gripping the world, this chaos prompted frenzied zinc supplementation and off-label use. It was further compounded by some observed lower zinc levels in some severe COVID-19 cases that you may also remember, where it was found that people with more severe disease has lower zinc levels. And there were multiple RCTs were being initiated without adequate controls to find out if zinc can prevent the disease or it has any detrimental effect on the health during COVID-19. In India, first wave of infections peaked around mid-September 2020. I think it's a mistake here. As the zinc lowering in severe infection is a part of normal nutritional immunity response, we endeavored to warn about the dangers of zinc supplementation during disease using the incidence and mortality data of European countries that already had first wave of infection by May 2020. So, evidence for zinc deficiency as a risk factor by first wave of infection. So, the question was, did epidemiology supported zinc deficiency as a risk factor for COVID-19? So, this map shows you how much the mortality was observed by May 26, 2020 around the world. As you see over here, more deaths was observed in Europe or Americas, and all these countries are known to have higher zinc sufficiency as compared to Africa and parts of Asia. That's why, so what we did, we took the countries of Europe that had already observed or experienced the first wave of infection and looked for association of zinc deficiency in the population with cases per million, as you see in the left panel, and deaths per million. As you can see, the zinc deficiency seems to be inversely correlated with your cases as well as deaths per million. So this observation was like deposited in medRxiv by June 12th, as you see over here, and it was also published in a Journal of Scientific Research.
Means death is not showing that zinc deposition or zinc percentage, zinc concentration.
No, over here, do you see here percent zinc deficiency in the population? Do you see the cursor?
छोटा दिख रहा है, हाँ. Yes.
It's percentage zinc deficiency in the population, and on the y-axis you have deaths per million over here.
Yes. Means this is not matching, na?
What is like zinc deficiency is not causing more deaths.
Yes.
So it was inverse.
हाँ. Means there is no role of zinc, है ना?
No, you cannot say no role of zinc, but
this is not
saying that
correlating.
zinc deficiency is actually causing more deaths is not appropriate, or it would cause more death. It was not appropriate at that time. So the data was not supporting that zinc should be supplemented.
Yes.
Based upon epidemiology.
Okay.
And the same thing is the correlation is shown in this table. So the zinc deficiency was actually negatively correlated with the cases as well as deaths per million of the population. So zinc deficiency prevalence in population seemed protective towards SARS-CoV-2 infection and COVID-19 mortality. So were there studies supporting zinc supplementation in COVID-19? So although all of us must remember that there were hundreds of papers directly, indirectly supporting its usage during active disease, and there were 60 interventional trials and 9 observational trials initiated to find out the benefits of zinc during COVID-19. None seem to consider, rather overlook the known variables affecting serum zinc levels and the futility of intervention for most recruited person in these trials, and also missing on associated mortal danger of intervention to those who had to be actually helped. Which were they? They were usually elderly and patient with comorbidities, and they were contributing 9 of 10 deaths, and they were experiencing more than 8,000 fold higher mortality as compared to the younger population. So, whether it was biases, lack of understanding, or conflict of interest, it's hard to say. But was promoting zinc
So means there is
supplementation.
no conclusion after all this research. ऐसा?
No, whatever research was initiated, they were just saying, okay, there is no sufficient evidence that zinc may be uh, killing the
Increasing in
people.
immunity.
Yeah.
Should I interfere? Should I interfere?
Yes, sir. Yes, sir.
Just 1 minute. It is COVID-19 is
Yes.
linked with, to me, it appears that it was linked with the food habits.
Yes.
The persons who were consuming
Yes.
fast food, and not our traditional food, they were more prone to COVID. Even in
Yes.
the comorbid cases,
Yes.
I had some of one of my best friend who died.
Yes.
His
Yes.
hemoglobin level reduced to 6%.
Mm-hmm.
So it has something to do. And when we also surveyed few cases of COVID deaths. And taking their history, what we found is that those you see in the rural area, compare the death graph, you will find that only 1 to 2% of the total death of COVID is from rural area.
Yes, that's true. And that's what you will find out.
Because
Yes.
of two things. Because of two things. They used our traditional food, and they were more active. They were leading more active life, and even they had no connection with the outside world. So if it is from China, so through air traffic, it entered into our, country. But then what I want to emphasize is that if you take any metal, zinc is also required in traces, and that is made available from our food. So there was no reason for this was from the pharmacology, these the pharma companies.
Yes.
There other created a sort of havoc that zinc supplementation should be done just to sell their products. If
And
we take traditional Indian foods, zinc is available in traces, and that was sufficient. So zinc has no role in preventing the COVID infection or recovery even.
That he is
Okay, that's
also
what.
trying to emphasize in his lecture that there is no direct correlation between zinc
It was the pharma companies who created havoc to purchase their zinc products.
That's why discussion and research should be carried out authentically so that we can
yes.
counter argument. We
Yeah,
must
It
have
still
sufficient data, then we can counter.
It still requires a large database.
That is
And
already available. That is already available, but most of the time, the policy planners as well, the people who have conflict of interest.
Okay, I agree, but that
promote
needs to be reinterpreted and re-explained.
So that's what we try to
Okay,
do, and you will see.
but I am happy because for last 1.5 years I have not been getting any time to join the academic world. Right now, just I was in leisure, so I just joined you. But I am leaving, but the university personnel with files are waiting outside.
Okay, sir.
But
Okay.
congratulate you for giving nice lecture and continue. We will be again joining. And I'm just
Okay, sir. Thank you, sir.
taking, yeah. गोपाल जी ऐसा ऐसा हो तो प्लीज इन्फॉर्म मी.
यस सर होता है ऐसा ही. और मैं यूट्यूब का भी लिंक सर उसमें शेयर किया हूँ. उसमें
जब फुर्सत हो रही रहती है ना, जैसे अभी था तो देख लिया. बड़ा इंटरेस्टिंग लेक्चर है ये. इसका आप देखिए तो जरा कॉपर से भी इसका लिटरेचर देखिएगा.
ठीक है सर.
ओके, थैंक यू सो काइंड ऑफ यू.
यस समर सर प्लीज कंटिन्यू कर दो.
Thank
सर
you.
बीएन मंडल में वाइस चांसलर हैं समर सर.
Thank you.
यस प्लीज कंटिन्यू करिए समर सर.
Thank you, sir. जी, thank you. So, let's see how zinc supplementation practices are closer to facts. So, zinc supplementation during acute infectious disease, what drives our consideration for popping up the pill? So, it's needed for healthy immune system, needed for immune system functions, humoral as well as cell-mediated immunity. It has pro-antioxidant activity, that is a major selling point for the zinc supplements. And then it helps in inflammation resolution. And zinc levels are low in severe diseases, that is zinc levels. And zinc has antiviral activity and is required for faster recovery. So if we look at these major considerations, so zinc actually does all these activities.
सर स्लो चल रहा है आपका इंटरनेट क्या?
half truths. Let's try. आप
प्लीज कंटिन्यू सर. स्लो मुझे लग रहा है जैसे आपका मूवमेंट.
की आवाज स्लो आ रही है, कह नहीं सकता.
वॉइस लैग हो रहा है सर.
अब आ रही है आवाज?
यस सर. यस
कोई
सर.
आपकी आवाज आने में भी डिले हो रहा है, शायद हो सकता
आपका
है
इंटरनेट स्लो लग रहा है मुझे. यस सर प्लीज कंटिन्यू सर.
ठीक ठीक, थैंक यू. So actually higher zinc concentration or higher zinc levels are pro-oxidant, and zinc levels are tightly controlled inside the body, and just 0.2% is present in the blood. And in any infection, inflammation is required for pathogen clearance, while its resolution is needed later. And in vivo, needed concentration for effective antiviral activity is 10 to 10,000 times higher than that can be achievable or attainable inside the system or inside a body. And serum zinc level lowering during disease is a normal nutritional immunity response. It is helped to protect the body, and it reduces inflammatory damage from superoxide dismutase activity. It reduces zinc's availability that is needed for pathogens replication and growth. So if you are supplementing zinc, you are kind of not helping your body. And zinc levels slowly return to normal levels with disease resolution in 2 to 3 weeks. And any zinc supplementation that we take orally, it takes many weeks to stably raise zinc levels. And also remember, zinc level fluctuation is evolutionary conserved and protective response. So devil lies in details. So let's move forward. So, how would you expect the zinc supplementation may affect COVID-19? So, based on our understanding of zinc metabolism, its sufficiency or forced supplementation during a disease can be safely predicted to be deleterious. However, the usage of zinc continued for COVID-19 infected with the steady publication of numerous opinion, perspective, and review articles that emphatically talked about key role of zinc in immunity and how deficiency could lead to adverse outcomes. Interestingly, the human studies were largely uncontrolled that included poorly designed trials and retrospective studies, which seem more interested in convincing us that there is no evidence of no determinant that we possibly most of us missed and took the zinc supplements. Let's move forward. So here the slide shows you the top one, the zinc levels in population. As you levels varied in different population over the globe. Here in Africa and parts of Asia, zinc deficiency is more common.
हेलो
And in the lower on the
सर,
right, cases per million
इंटरनेट
that were
आपका
observed during
बीएचयू
the
कैंपस में
COVID-19.
भी इंटरनेट इतना स्लो है?
हाँ जी, हेलो
बीएचयू कैंपस में भी इतना स्लो इंटरनेट चल रहा है?
भाई बीएचयू ने
हेलो,
ये भाई ये कौन सी केबल होती है आजकल जो आती है?
हाँ
फाइबर ऑप्टिक्स.
हाँ 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 हाँ,
अब स्लो क्या कह सकते हैं.
बीच बीच में रुक जा रहा है आपका.
So let's move forward. So we again embarked on finding out or trying to give the population evaluation of 23 socially similar European populations, how the COVID-19 impacted them, to again make people aware of the possible dangers of zinc supplementation. So as I mentioned here, the study population had high comparable that was considered or evaluated. It was 522 million, showing for COVID-19 was having more than 150-fold difference in COVID-19 deaths. So it was suitable for our evaluation, epidemiological association study. So let's move forward. So this is the graph that shows how these population with different zinc sufficiency behave
सर आप कैमरा बंद कर लीजिए तो हो सकता है. सर आप कैमरा वीडियो बंद कर लीजिए एंड देन प्रेजेंट करिए तो हो सकता है इंटरनेट का वो कम हो.
more than zinc of 5% shift to the in countries. So we may ask how extensive was the correlation of higher zinc sufficiency with rates of COVID-19 incidence and mortality. So if we look at this same European countries and this shows the how this notification rates of COVID-19 varied for these European countries that we have studied, and lower one has as we already experienced first wave of infection. So only the phased matched population was evaluated for correlative studies, and when we look at the correlation, as you see here in this table, starting from 12 these cases were directly and positively associated with zinc sufficiency of the population. So we can say that starting from pre-peak to post-peak of wave of infection, the association remained strongly positive, or zinc sufficiency in more cases. So it could kind of negate the narrative that zinc would be helping the population to either prevent the infection or recover from it faster. So this slide again summarizes the whole thing that we have just talked. So finally, this years in immunology after much debacles or rejections. So let's move forward. So from the same paper, I have just put some excerpts so we can read, or you can see for yourself, that how zinc supplementation in COVID-19 would have affected population. As a part of nutritional immunity, so the drop in zinc levels is primarily attributed to serum zinc levels is primarily pro-inflammatory cytokine
नीरज सर आवाज आ रही है आपको?
कट रही है।
alteration acute phase
हाँ
of
वही तो
infection.
पता नहीं बनारस में है सर
Restrictions
कैसे
relocate
दुनिया इतना बढ़ गया इंटरनेट
and or intoxicate any pathogen. हाँ मेरी तो
प्लीज
हेलो
कंटिन्यू
आवाज आ रही
कुमार
है?
सर,
सर गायब हो जा रही है
सर।
आवाज अभी आ रही है
हाँ
सुमर सर आप अपना वीडियो बंद कर दीजिए।
हाँ वीडियो सर आप बंद कर दीजिए तो हो सकता है ठीक से आवाज आएगी
वीडियो
यस सर वीडियो बंद कर दीजिए सिर्फ स्लाइड दिखाइए और बोलिए सर ये जो कैमरा है ना उसको टर्न ऑफ कर दीजिए सर
अच्छा वीडियो बंद ठीक ठीक है एक मिनट
नहीं 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 वो रहने दीजिए ना सर आप अपना कैमरा सिर्फ नीचे
नहीं तो
कैमरा
यहीं से तो बंद होगा कैमरा
हाँ हाँ
नहीं, नहीं,
बिल्कुल
नहीं।
बिल्कुल बिल्कुल
बिल्कुल सिर्फ आप
वहीं से
अपना
नहीं
कैमरा
कर रहे।
बंद करिए बाकी चलता रहेगा
हाँ वही कर रहे हैं गोपाल।
हो गया
हो गया सर।
हाँ सर
हो
आप
गया।
दिखाइए
हो
सर
गया ठीक 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 तो
हेलो
सप्लीमेंटेशन ऑफ जिंक है हाँ जी आ रही है आवाज
यस सर आ रही है
कंप्लीट रहे सर।
प्लीज कंटिन्यू करिए सर
हाँ So the supplementation of zinc has been shown to revert the calprotectin mediated growth inhibition. It is already shown by many people. And zinc starvation strategy could primarily interfere with the zinc dependent infection process and replication, while the intoxication could help the generation of reactive oxygen species in a localized manner for effective pathogen incapacitation and elimination. Another thing that I would like you to read or pay attention to, that zinc levels are tightly regulated in human body and its differential levels are maintained in various organ tissues and extracellular milieu, including serum, through a complex homeostasis mechanism that involve multiple regulators and transporters. And during infection, the levels of zinc are reduced in serum, and it is redistributed to tissues and immune cells that we most of the time miss when we see zinc levels are reducing in blood during an infection. And it is a part of nutritional immunity to enhance immune cell function and also check pathogens growth and replication. and zinc supplementation are known to promote adverse effect in severe disease conditions that are or were identified as comorbid conditions for COVID-19, such as sickle cell disease, chronic kidney disease, cardiovascular disease, coronary heart disease. In all these conditions, zinc supplementation is known to cause adverse effect. But even then, the population which is dying from COVID-19 and were comorbid were prescribed this zinc supplementation. And one thing that we should always remember that the serum zinc just represent less than 0.2% of total zinc present in body, and more than 2 to 9 weeks are needed even if we are at taking a diet zinc diet that has almost no zinc. It would take 2 to 9 weeks to show appreciable depletion in average zinc levels. So even in the disease when we are not taking food, we should not be worried about lower zinc levels. Furthermore, due to inter-individual variation in serum zinc levels and their response to zinc supplementation, serum zinc levels are never a reliable indicator of an individual's zinc status. The remarks made by Hess et al. Are quite eye-opening for this. An individual's serum zinc concentration, as written over here, just a minute. An individual zinc serum, sorry, an individual serum zinc concentration does not reliably predict that person's response to zinc supplementation. Whereas serum zinc concentration can be considered a useful biomarker of a population's risk of zinc deficiency and response to zinc interventions, although it may not be a reliable indicator of an individual zinc status. Quote. So, as this paper is from I think 2006, and it explicitly states, based upon analysis of previous data, that zinc should never be used as an indicator of any person's response or its deficiency. Rather, it should be considered just as a population at a population level to say the population is getting lesser zinc or more zinc in comparison to other populations. So, how do you see zinc supplementation or actively maintaining zinc sufficiency during active infection? Or would you recommend zinc supplements during active infections for yourself? As for me, I would say I would not recommend zinc supplementation during any active infection. So, on publication of our paper, did it change the practices during COVID-19? The answer would be yes and no. So, after publication, our publication, a person from South Indian state contacted me about my paper, that what I am talking about, should zinc be used or it shouldn't be used. So after the talk, he was member of some committee that was giving recommendation about zinc supplements that should be given to population. It was removed from number of South Indian states, and this paper cutting shows you here about the Goa's policy change that caused or removed zinc from the COVID-19 home kits. But if you look at this one from Uttar Pradesh, as late as in January 2022, it was still prescribing or giving zinc as well as vitamin C, ivermectin, as well as azithromycin and paracetamol for a measure against COVID-19. So yes, some practices did get changed at some places, but at other places it didn't get changed. So, has the alarm raised by June 22 over adverse impact of zinc supplementation during COVID-19 ever got supported. So this is a screenshot of a live meta-analysis. So by 24th March 2023, it does show that the zinc supplementation was harmful. But if you look at 27 January 2021 data, it was not showing is an harmful. So it did take time to finally make it through this meta-analysis network. So did the zinc deficiency or sufficiency remain associated with higher COVID-19 mortality till the end? So this is the zinc deficiency sufficiency map of the whole world. And this is the COVID-19 mortality by June 26, 2020 that we have just discussed. So if we look at the mortality rate from COVID-19 by April 6, 2025, you can still see the regions which were having more zinc sufficiency or less zinc deficiency had more mortality as compared to the Africa and parts of Asia, which were traditionally zinc deficient regions, or here the food may be providing less of zinc. So myths promoting zinc supplementation during acute infectious diseases. This table gives you a fact check. So let's look at the first myth, that is low zinc levels in blood indicate deficiency. So the fact is absolutely no, it doesn't do so. Actually, the zinc present in blood just represents 0.2% of the total body reserves. So in itself, these levels just represent current physiological state of a person and are inconsequential for a disease or its outcome. And they never indicate the seriousness of a condition that may require supplementation. The second myth is zinc levels in blood are fairly stable. The answer is no. Almost everything affects serum zinc levels, from your age, sex, meal, time of day, infection, inflammation, stress, pregnancy, genetics, etc. And on an average, zinc level fluctuate as much as 20% during a 24-hour period. Time of day, proximity of previous consumed meals, and many more things affect zinc levels in your body. So the third myth is a 10 to 20% zinc decrease may indicate a serious deficiency requiring immediate attention. It is completely untrue. A 30 to 35% intraday change can be seen in all individuals, and low plasma zinc is a non-specific effect of systemic illness, and it is similar to that seen with plasma's copper and iron levels too. So whatever we are discussing here is about zinc, but the same thing is true for copper and iron levels too. So they do show the non-specific effect of systemic illness, but not
Sir.
something that is during infection.
Samar sir,
Hanji.
in
Hello.
compared to, yeah, sir, can you hear me?
Yes, I can hear you.
Sir, if I remember correctly, then copper and iron, they
Uh-huh.
are 3 to 4 magnitudes lower in concentration compared to zinc.
Uh-huh.
That is much more. That's very much different. So actually, to put them at the same place, it is little. What do we call it?
No,
It is
here I am
comparing.
just emphasizing. No, I'm not comparing. I'm just emphasizing that even for copper and iron, whose levels are also display the change during a day's time, and they actually also reflect that non-specific effect of systemic illness, just like zinc.
Okay.
So their change in the levels should not be construed as a is severity or gravity of a illness.
Okay,
Rather,
okay,
we should be looking for the cause of that lowering of these levels
okay.
and fix that, rather than
Okay.
supplement people with more copper or more zinc or
Now,
iron.
those could be
That's what
dangerous
I mean to
actually.
say. Huh? Yeah, that's what I mean to
That
say. Like, because
that
whenever we are supplementing any of these, we are actually causing toxicity and more chances of that person to die rather than
Mhm.
helping him out.
Yes, sir.
May I move forward?
No,
Yes,
please, sir.
yes, sir, please.
Yeah. So the fourth myth is zinc levels get dangerously low with reduced food intake. It is also unfounded, and most of the time it is used for prescribing zinc when people are not taking food. And so, as you see in the comment section over here, that studies in healthy volunteers indicate that it takes more than 5 weeks to start showing appreciable decrease. That is just about 35% in average circulating free zinc level, even when we kept on almost zero zinc intake per day. It was like a less than 1 mg per day, and they were on synthetic diets. It's 1973 paper. So zinc levels are not like go that low, which may be dangerous when we are fasting or not taking food during infections. The fifth myth is zinc supplements restore the zinc levels instantly. It is false, as zinc levels naturally gets restored with disease resolution. And the sixth one is zinc supplementation could promote a speedy recovery. It is false, and it may delay if you are taking zinc during a disease. It could, as it is written here, it could delay recovery and increase inflammation related oxidative damages. And large doses could be deadly for individuals with impaired zinc homeostasis, whom we are actually trying to help. It would be deadly for them. So let's move forward. So this slides give you zinc supplementation needs during disease in different risk groups. So on the top, you have people who, due to age or lifestyle, they show reduced zinc levels. And there are people who have infectious disease, or they have medical condition, or due to treatment or toxicity of other drugs. So actually, if zinc levels are being disturbed or at much lower level, so only the people who are of concern may be looked at or monitored for giving them supplement, while the people who are showing the zinc levels lower due to age or their lifestyle, they may not be considered, or they should not be actually what's say monitored for low zinc levels. But it should be noted that medical conditions with disturbed zinc homeostasis due to increased loss, malabsorption that causes transient but more acute deficiency may possibly require supplementation in some situations. Like if someone has a surgery of alimentary canal, then they definitely need zinc. But in other cases, most of the time, you don't require zinc during an infectious disease. So let's move forward. So what different agencies can do, I would say preventing misinformation or giving precise guidelines would be helpful. As you see here in WHO, it talks about micronutrients such as vitamin D and C and zinc, and says that they are critical for a well functioning immune system and play a vital role in promoting health and nutritional well being. But it also says there is currently no guidance on the use of micronutrient supplements as a treatment of COVID-19. Rather than saying, it could have said that it should not be given unless prescribed by a physician. And if we compare with this another flyer from the WHO that are antibiotics effective in preventing and treating the new coronavirus? As you can see here, it explicitly states no, antibiotics do not work against viruses, only bacteria. The new coronavirus is a virus, and therefore antibiotics should not be used as a means of prevention or treatment. So I would say that for the same kind of language may be used for zinc or other mineral supplements that are currently used for different infections, including COVID-19. So I will just skip. This is a just UP government letter that I already talked about, that they were still giving you zinc supplements and antihelminthics as well as antibiotics for this viral disease. Let's move forward. And different websites that also talk about taking zinc, I think they should be regulated. They just talk about like when you have less zinc, what kind of problems you would face. So people just think that okay, as zinc may not have some adverse effect on their health, they just take zinc supplements without any prescription or need. So in nutshell, we can say that zinc present in body or blood only constitutes 0.2% of total present in the body, and its levels are never an indication of deficiency. Normal range of absolute zinc in serum blood differs from person to person. It displays variation with time of the day, food intake, genetic composition, sex, etc. And any decrease in the plasma zinc levels during acute infections is a normal protective response, and any fear of lower zinc levels in blood during acute infections is not justified. The zinc levels return to normal range for a person in 2 to 3 weeks post disease resolution. It is automatic, you don't need to give zinc. However, always seek medical advice if there are other concerns, complications, as we just talked about. And last thing is, remember to treat the cause of a disease if known, not the symptomatic defense itself, which is in many viral diseases or diseases, acute infectious diseases, it's the zinc concentration lowering. And these are some of the suggested readings. The top three are the papers that we have already discussed, and the fourth and fifth can be referred for this plasma zinc concentration and how it varies and whether it reflects real danger. And this National Institute of Health Office of Dietary Supplements can be referred for if you still think that you are not getting enough zinc or you need supplementation. It explicitly gives you uh, values or daily needs that get fulfilled from your portion of food, and you can find that most of the zinc needs are uh, fulfilled from whatever we eat normally, and we usually get more than that is needed for a day. So let's move forward. With this, I like to thank you, and your queries, please.
Thank you so much, sir. All these information should percolate to the society. बहुत सारे मिथ चल रहे हैं, इतना ये खाना, इतना ये खाना. हमने तो देखा कोरोना टाइम वायरल इन्फेक्शन में एंटीबायोटिक भर भर के दे रहे थे, है कि नहीं?
जी जी.
So I request participants to ask question.